If you were to think of a hierarchy in terms of radiology studies, are you saying that the X-ray would be probably the first level of approach, maybe then a scan, a CT scan, then a MRI, bone scan, things of that nature? Is that how would you categorize the hierarchy? And then what what does each of these look for?
Open ranks, march!
Oh no, that's a really good question. So the first part is, do you have wording that the VA doctor can stop on the conclusion of the X-ray report that will just verify what the the service member is already saying, which is that, listen, doc, I got pain here in my knee, and it's service related. And if they pull open an X-ray report and it says moderate to severe knee joint degeneration, that's going to be confirmatory enough. They're not going to need to dive in much farther. What they will probably do is they will probably get a third party X-ray to confirm it. Oftentimes at the occupational health clinics surrounding VAs or VA centers. But once that confirmatory study comes in and they say something similar, then that's going to be enough for the VA claims radiologist who's reviewing it to say, yeah, that's legit.
Okay.
But there are very real cases in ligament or tendon injuries of the joints or in back pain where there may be another study that needs to dive farther into it. And so, say, going back to the knee, if you have pain in the knee, but say, for instance, your X-ray is relatively negative, not too many findings on it or none at all, and you're like, but I still have pain. This is where I would say the second next study that the VA claims radiologist or doctor is going to look at is going to be the MRI. The reason I say that is because you can tear your ACL, you can tear your meniscus, you can have some pretty significant meniscal degeneration in the knee, or you can have some large disc herniations in the back that aren't going to show on the X-ray. Yeah, so I would order probably X-ray, and then for when the X-ray can't confirm the retiree or service member's pain, then probably MRI is going to be the next go-to study.
And so the X-ray would look at just. Are you saying the X-ray would look at bones predominantly, and but not anything with ligaments or tendons or anything of that nature? Is that correct? Well, from an X-ray,
Yes.
okay. So explain the MRI, right? Because I think there's a little bit of confusion amongst the veteran space of, oh well, I got a picture. They'll say I got a picture of my knee, and the picture said that there was a fracture. Well, was that an MRI? Yeah. The doctor said it was an MRI, but the picture actually, when you review the medical record and you see the impression is actually talking about two views, and it's talking about an X-ray. It says X-ray right there. What is the X-ray review and does not review, and then what is the MRI review and doesn't take into consideration?
Yeah, so the X-ray is going to look at long-standing changes in the bones. And so that's why you're going to see that word degeneration or arthritis, or sometimes we'll put in the term osteo, meaning bone osteoarthritis. So the X-ray is reviewing long-standing changes, which is why the X-ray is pretty confirmatory once you get to that moderate or above level. But diving further in is when you haven't had time enough for those secondary changes to take place on the X-ray to the bones, is you're going to start looking inside of the soft tissues. And that's where the MRI comes into play. And both a CAT scan and an MRI is going to look like you're being placed inside this large, giant donut. The CAT scan is going to be relatively quick in comparison to the MRI. It's going to run you through in 2 to 5 minutes or less. And the MRI, you're going to be inside it for probably a good 12 to 25 minutes. It's going to be really loud. They're going to have probably placed headphones on you to drown out that noise. And you're going to hear a lot of popping and knocking and clicking going on, which are the different MRI components taking place. And so to try to understand, once you've gotten beyond the X-ray process, which if you've had a CAT scan or MRI, CAT scan's quick and not noisy. MRI is a lot longer, and it's going to be really noisy to the point where they're going to put headphones on you to drown out that noise.
Okay. And so with the CAT scan, what is the CAT scan actually? What is that? What is the CAT scan?
It's going to be 3-dimensional X-rays. And in the world of joint imaging, it doesn't come into play as much except for fixing fractures or
Hmm.
prior to a joint replacement. And if you've gotten to that point as a service member or retiree, then you have enough radiology reports to show like, yeah, fracture due to this reason, joint replacement due to moderate to severe arthritis or degeneration. And so your CAT scan of your joints aren't going to play as much into the VA claims process as will your probably tens or 20s of x-rays of that same joint leading up to that point. In fact, it'll be a good record to show that you truly do have the end result of damage to a bone or to a joint.
Close ranks, march!